Lupus is a disease that occurs when the body's immune system attacks its own tissues and organs. That's autoimmune disease. Inflammation caused by lupus can affect many different body systems, including the joints, skin, kidneys, blood cells, brain, heart, and lungs. Lupus can be difficult to diagnose because its signs and symptoms often mimic those of other ailments. The most distinctive sign of lupus is facial rash that resembles the wings of a butterfly unfolding across both cheeks. It occurs in many but not all cases of lupus. The signs and symptoms of lupus that we experience will depend on which body systems are affected by the disease. Today on your regular Health TV talk show, The Physicians, will be discussing lupus, the signs, the symptoms, the causes, diagnosis, and management. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, you train back supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agberian, your regular anchor on this program. And with me is my very, very, very intelligent co-host.
I'm Dr. Memuna Yusuf Kadri, and of course, welcome to your favorite Health TV talk show, The Physicians, where your health is our business.
Yes, we're going to be discussing lupus and autoimmune disease. Have you ever had any patients with lupus before?
I had one that we needed to do counseling for. I think when a lady in her reproductive age, I think she had just had our first baby, and the baby was about like 3-4 years, and they're planning for a second child, and then the diagnosis
just
and
made.
She just went off the there's something about when I think we also as medics we have a lot to do with that. There's a name of a disease, and then the way you also present it, and of course many people these days, they are Google doctors.
So the internet certified doctors.
Like the doctor took time, explained everything, but of course, when you go to internet to be telling you are dying today, in fact you are dying now, better start running.
Your body is reacting, it's rejecting you. You haven't seen where your whole body is rejecting itself.
It was a whole lot for her to take, and so they called in, being a psychiatrist, I didn't know why they had to call me in though, but it's supposed to be like a counselor talking to her, but they believe that if they don't bring in a very strong expert, it will be, she may start having, because she started behaving, talking to herself, and she's still very much alive. Like this is years ago. If it's
detected and you are under proper management, I don't think you have challenge.
In fact, she didn't have even the
what happened was the lady that came to me said, Dr. Agberian, I'm dying.
Imagine that.
Yes, she said, Dr. Agberian, I'm dying. I don't know what's happening. That she traveled to her village, and after a period of time, she just noticed this butterfly.
My did even have this
butterfly shape on her face.
She didn't
know what. Somebody just said, "What's happening? Your face? Do you have a butterfly on your face?" And they noticed it. And she said she has been using so many things, and it kept coming. So I explained to her what actually was happening. They referred her to a rheumatologist to manage her. I don't think it's very common in our environment.
But I think it's more, yours is a female.
Yes.
And mine was, so I think it's more in females than males from what the research is and, review. Because I had to sit with her doctor during the whole discussion. And I was, for me, I was quite enlightened because it's not something that you just pick on a random basis. And
among blacks and the white, they said it's more common in the Caucasians, actually.
Than the
most things are actually more common in the Caucasians.
You think so?
We'll be back after this short break. Just stay tuned. Don't go away.
every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Some days are tougher.
Welcome back. If you have just joined us, you're on to a regular health TV talk show, The Physicians, where your health is our business and will always be our business. Today we'll be discussing lupus, the causes, the risk factors, the signs and the symptoms, the diagnosis, treatments, and if possible, complications. With me in the studio is a consultant rheumatologist. He is also a senior lecturer at the College of Medicine, Lagos State University Teaching Hospital, and a consultant rheumatologist also at the same hospital. Doctor, you are welcome to our program. He is no other person than Dr. Hakeem Olaosebikan. You are welcome to our program.
Thank you for having me. I'm very glad to be here.
You're welcome, sir.
You are welcome.
Well, I'm very excited. Having a rheumatologist on our program is actually a privilege.
Wow.
Thank you, thank you, thank you. So now, before we go deep dive into the main thing, you want to just tell us a general overview. What is lupus? Just give us a general overview before you talk about the causes, the risk factors, so that people will know what it is.
Yeah. Thank you so much for inviting me. Thank you for this advocacy. Lupus is a condition I'm passionate about, and I'm ready to spread the gospel to everyone about lupus. Now, the way I describe lupus to lay person is that we all have immune system. What our immune system does is to fight germs, to safeguard our body against diseases, to protect our body. But sometimes our immune system go crazy, turn around to attack us instead of primarily protecting us. So any disease that occur because our immune system is fighting us, is attacking us, is called autoimmune disease. Auto means self, immune system attacking that person. So there are about 100 diseases under this autoimmune umbrella. Lupus is one of them.
Okay.
There are other diseases like rheumatoid arthritis, Sjogren's syndrome, systemic sclerosis, a lot of big names that it might not be very easy for ordinary doctor to diagnose, except that patient get to see a specialist that knows about autoimmune system. So lupus is an autoimmune condition characterized by our immune system fighting our body.
Any particular reason why it just does that?
Sure. Now, the specific reason why our immune system is being attacked is not known yet, but there are certain risk factors or certain tendency that will increase the risk of our immune system attacking our body. So we need to start from, family history. If one has a family history of any autoimmune disease or even lupus, that person has increased risk of developing lupus. That is one. If that person is African American, you understand, or Hispanic Americans or Asian Americans, they are more likely to develop lupus than Caucasian. They are more likely. So if that person is black, you are a black race, you are more likely to develop lupus than non-blacks. Then if patient has history of use of some hormonal products, either medications or hormones, you are exposed to those hormones, it can actually trigger the immune system. If one has genetic genes or proteins that determine diseases, if one inherits lupus genes or lupus protein genes from our parents, and you are exposed to some environmental factors, which I will talk about later, it can interact with that gene and stimulate the immune system to go into overdrive. That is so. The cause of lupus or any autoimmune disease, specific cause not known. However, there are certain risk factors or certain things that increase the risk of developing lupus. So some of them are reversible. Some of these risk factors are non-reversible. Like if you are black, it's not your fault to be black.
Sure.
If you have a family history, it's not your fault. But there are some environmental factors that have been implicated in lupus and other autoimmune. One is infection. If you have had an infection in the past, you understand, this infection can actually lead to triggering of our immune system to go into overdrive. if you have been exposed to noise environmental pollutants, chemical, in the water we drink, in the atmosphere, that is climate change issues is very important. Because if climate change is not well addressed, it will lead to a lot of diseases, including lupus and other autoimmune diseases. So exposure to toxic chemical, toxic fumes, smokes, in our environment can actually increase the risk of lupus, especially those that have genetic basis. Now, if vaccinations, as good as vaccination is, autoimmune disease can be triggered by vaccination too, but the percentage of that is very, very low. Then some medication you are using for something else can also trigger lupus. But lupus that are triggered by medication are actually transient lupus. It's not permanent. Okay. Once you stop the drug, the symptoms abate. You understand? The exposure to sunlight, excessive sunlight exposure to sunlight can trigger, lupus crisis. It might not cause lupus directly, but it can trigger lupus crisis. We'll talk about that later.
Especially if you are predisposed
to having lupus. Stress, psychological, emotional, physical stress, but not directly. As I said, no one can develop lupus if you don't have the gene. Genes are proteins that we inherited from our parents. Our parents may not have the genes themselves. They may not have lupus themselves, but they may inherit lupus gene. They may have lupus gene, and they can transfer that gene to us by giving birth to us. So once that gene now encounters an appropriate environmental factors, the genes interact with the environment to stimulate the immune system to go into overdrive. So immune system now produce some proteins called antibody that start to attack our body. It can attack one part of the body at a particular time and subsequently attack other part of the body, or attack multiple parts of the body simultaneously. So it can be sequential attack or concurrent attack.
Wow.
You understand? And once that attack now happen, what happened there? There's inflammation. And inflammation happen in those organs. And inflammation now lead to all those complaints, symptoms that if they attack the joints, patients start to have joint pain, joint swelling, joint stiffness. If it's the skin, you start having skin inflammation, eczemas in the face, hair loss, sores in the mouth, sores in the throat, sores in the nose. If it is the kidneys, patient can develop kidney failure. If it is the heart, it can develop heart failure. So it depends. If it's the brain, somebody can be psychotic, can be behaving irrationally, restless. Apart from the news of the breaking the bad news, the disease itself can actually cause depression, anxiety, schizophrenia, hallucination, psychosis. So lupus affects any part of the body, anyhow, anyway.
How common is it?
Okay, now in Nigeria, because there are few rheumatologists in Nigeria. In Lagos, we are 6 rheumatologists. In the whole of Nigeria, we are less than 50. So that means that
population of
rheumatologists. That means that a lot of patients will be underdiagnosed, or even misdiagnosed, or delay in getting rheumatology. Because patients would have seen some other doctors that don't have a clue about this, because autoimmune conditions are not common. So, and the first thing, as you said in your intro, that the symptom mimic, common ailments. The initial symptom is malaria typhoid feeling. It is not true malaria, and neither is it a true typhoid, but it's a malaria typhoid feeling. So if you go to a doctor, the first thing they think of is malaria.
Sure.
So coming in and out of malaria typhoid complaints. From there, they start having fatigue, unexplained weight loss, unexplained fatigue, unexplained problem with low appetite, muscle pain, which can mimic anything. It can be infection, it can be malaria, it can be typhoid. But before they get to rheumatologists, what happened? They develop organ damage because it's already advanced.
They have gone to
understand? So the early signs of lupus are surely mimics other common things. So it's quite very easy to be misdiagnosed. Now in Nigeria here, thankfully we have a lupus registry. We got the lupus registry in Nigeria. Okay. Where we upload cases of lupus that have been diagnosed. Okay. The registry was actually initiated in 2021. Okay. And at the moment, if not because of the COVID-19 lockdown or anything, at least we could have had more patients uploaded into that registry. But at the last time I shared the registry, we have 776 cases. But surely there are more than that. You understand? So it's uploaded because so there are more. Because if I look at our clinic in LASUTH where I work, we follow up more than 200 cases of lupus. And there is a patient, they had different support group. They have different foundations, and they have their WhatsApp group that some of us are into. There's a WhatsApp group that I am now. Lupus patients set up that WhatsApp group. There are about 500 and something lupus patients in that WhatsApp group all over the country. So as those that get to, to be added into the group. So we can't say it is rare. It is just that it is underdiagnosed, it is misdiagnosed, and most patients present late because of lack of capacity to diagnose the condition.
So how, two-pronged approach question, are there gender differences to lupus and also age when it comes to age? Because now we're talking about underdiagnosis, misdiagnosis, because I think it's underdiagnosis is higher.
Sure.
Or is there like a certain age that we should be looking out for, or is it more common among a particular age group? And of course, if there are gender differences when it comes to
thank you for that question. Just like any other autoimmune diseases, lupus is more common in female gender than male gender.
Why now?
And the reason is that hormones, female hormones are proteins in our body that control our behavior, the way our body functions. They are female hormones, they are male hormones. The female hormones have been found to be immunogenic. They trigger our immune system to go into overdrive. Okay? And being female itself, I don't want to go in deep into genetics. Female has double S.
Yes.
Male has SY. We are SY. The extra S that female has also has been found to have some immunologic function as well. So making female more predisposed to developing lupus than male. So if you have 10 people in this room, 9 out of those 10 will be female with lupus. 9 and 1 will be male. However, if a male has lupus, it is more severe. It is more life-threatening than in female.
Is there a reason for that?
A time will come when that should be at an advantage.
There are some genetic determinants of severity as well. Now, the other aspect of it is that it is common. 60% of lupus patients, they are within their reproductive age.
Okay.
Maybe age of 16 to 45.
Okay.
60% of lupus. However, about 15% to 20% of lupus are seen in children as well. So lupus can also be diagnosed. We have got juvenile lupus or child or pediatric lupus. Lupus that you see in people less than 16 years of age or 19 years of age. And lupus can also be diagnosed in neonates.
Are you serious?
Yes, we talk about that. We call it neonatal lupus. So a mother with lupus can give birth to a baby with lupus. Or even if you don't have lupus, but you have certain antibodies, you can give birth to a baby with lupus. Okay? So lupus can be seen, and then about 15 to 20% can also be seen in elderly. So anybody above 50. But the age that has lupus, the predominant age is that age between 16 to 45, reproductive age. That is the people that have. So how do you recognize lupus? How do you identify lupus?
Exactly.
One, if a female comes to rheumatology clinic with complaint of unexplained tiredness, unexplained fever. So don't assume that you, as a general practitioner, you see patients continue to come to you with malaria all the time. Malaria cannot be. You cannot have malaria 10 times in a year. It's not likely, because you are not the only one that's been bitten by mosquitoes. So for you to be having malaria feelings on and off, in 3 months like that, please suspect it might not be something else. It might be something else. It can be lupus. It can be an autoimmune condition. It might not even be lupus. It might be other autoimmune disease because they all almost have almost similar presentations. It could be cancer, for God forbid. You understand? So once you have unexplained fever, on and off, unexplained tiredness, unexplained fatigue, unexplained weight loss, progressive weight loss, feeling of unwell that has been on and off, and you have done basic tests, and you cannot find the reason, the doctor cannot find it, it's better to refer to a rheumatologist or a specialist hospital where someone will identify and refer appropriately. Instead of sitting on the patient, start to give the patient malaria drugs. Now, lupus can also affect, apart from general symptoms, it can affect the joints. Patients with lupus can be very with arthritis. So arthritis erroneously has been said to be an elderly disease.
Exactly.
But it's not, because even children can have arthritis. And when children develop arthritis, this is usually immune mediated. It's an immune system that attacks their joints. Now, there's what is called juvenile lupus, the one you see in children less than 19 or less than 16. The neonatal lupus, the one you see in newborn. There is what is called skin lupus, or cutaneous. It just affects the skin alone. They can have hair loss, they can have scars on the hair, they may have hair loss that is non-scarring. Non-scarring means that the hair follicles are still intact,
Yeah.
so there is possibility of a hair regrowth. And they can be scarring. There's a hair loss, but there's no possibility of regrowth. So there's a scar on the hair. They can have sores in their mouth, recurring sores in their nose, in their throat, and their skin irritations, eczemas, and all those, so that without affecting the internal organs. The another lupus is called systemic lupus. Beyond the skin and the joint, it can affect the kidneys. The blood cells, they can have unexplained low blood level. They give them blood transfusion all the time.
That is
They don't know that is a lupus that is attacking the blood. In the Canada, eat the blood at the bone marrow level.
Oh,
That
I
is
think it's a leukemia.
the factory, as if
Exactly,
it's a leukemia.
as if it's a
Good.
leukemia.
They can eat the blood inside the circulation as well. So the blood continues to drop
The person will always be
without
anemic.
bleeding,
Yes.
anemic. So they can affect the kidneys, as I said. They can have puffy face, swollen legs. You know, they pass foamy urine, persistent urine that is foaming. You know, they can develop high blood pressure because of that. It can affect their hearts. They can have fluid collection in their accumulation in their hearts, fluid accumulation in their lungs. We call that effusion. They can actually, it affect the brain. They can have convulsion, unexplained seizures. They can develop stroke. They can develop psychosis, hallucination, restlessness, agitation, irrational thoughts, all this anxiety, you know. So now it can start to do a systemic lupus. Then we have a lupus which we call neonatal lupus, as I said. Now, when we say neonatal lupus, what happens is that lupus mother, a woman, a mom with a pregnant mom with lupus, if that person has certain antibodies, which I'll talk about when you talk about diagnosis, the antibody can be transferred, not in 100%, in less than maybe in less than 5%, can be transferred from that mother to that unborn baby. So that unborn baby, the risk of developing lupus in that child is less than 1% in that baby, that is the first pregnancy. But the risk increases with subsequent pregnancy if that woman still has that antibody, the antibody I'm talking about. Now, if you are a relative of lupus patient, you don't have lupus, but you have the antibodies. Because it's, as I said, it is a familiar clustering. It runs in family. You might not have lupus, but you may have the gene. Because it's your sister, or you have the antibody. So if you have antibody, but you are lupus free, but you have the antibodies, you can also have your baby, and that antibody may also transfer from you to that on your unborn baby. So it's not necessarily mean that you have lupus before you develop neonatal lupus syndrome, especially if you have a family history of lupus, or you have a history of other autoimmune conditions, because there's what's called overlap. Autoimmune condition can overlap. Patient with lupus can have rheumatoid arthritis. Patient with lupus can have type 1 diabetes, which can overlap with lupus. You know, these are autoimmune conditions as well. Asthma is an autoimmune condition. The allergy disorder, they are autoimmune as well. They can overlap. All this there could be overlap of autoimmune diseases. So when the children have most neonates with this lupus, most of the symptoms they have are usually reversible. However, there is one symptom that they have if it affects their hearts. It may not be reversible. So if the baby that are born alive, they may actually need a pacemaker.
Wow.
That baby, because if they have a heart block, that is not reversible. But the skin symptoms that the baby has, the blood symptoms that the baby have, the liver symptoms, all those ones are reversible after birth. So what we don't pray for is that the baby to develop an heart block. So once lupus mother is pregnant, the person needs to register in teaching hospital where there are facilities for neonatal care, where there is a facility for fetal care, where there are facilities for monitoring of this woman and also the baby. So a lupus mother or a lupus mom, once they are pregnant, they should be registered in a teaching hospital or multi-specialist hospital because of the pregnant is high risk anyway. The lupus mom, once they are pregnant, is an high risk pregnancy because of the risk of that disease to them and the baby.
It's very obvious we're going to continue part 2
of this
because
discussion.
this topic is very extensive. So I just want to say, just hold it there and we'll continue with the part 2. So as you out there, I'm sure you have had you've been tutored on today's topic on lupus because the time is not enough. So we're going to continue part 2 next week. Don't go away. Stay tuned and watch us next week. Thank you.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diaravite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diaravite from LB Pharma. Diaravite. Love yourself.